Hi, my name is Kari Reimann. I'm a certified nurse midwife, and today I have with me Brook Kalisiak. She's a doctor of physical therapy and specializes in pelvic floor physical therapy. She has 20 years experience in the field and is the owner of Legacy Physical Therapy with locations in Valley Park and in St. Pierre's. We're so excited to have you today. Thank you so much for coming.
Thank you very much for having me. I'm excited to come talk.
Thank you. So let's jump right in. What exactly is pelvic floor physical therapy?
Yeah, so pelvic physical therapy as a field has been around for decades, but many people still don't even know that it's a subspecialty out there. But our pelvic floor muscles, and I never go to a talk without bringing my pelvis.
Awesome.
Our pelvic floor muscles are a little bowl on the bottom of our pelvis here. So anything that's in this red color is muscle that's in the area. And these muscles form a bowl on the bottom of our pelvis. And if they're not there, we have some really big issues. And that bowl helps to make sure that our pelvic organs stay where they need to be. So our bladder and our uterus and our rectum need support up and in. And those muscles are also what we learn to use when we're potty training as kids. And that's so when we're learning to not pee and poop on ourselves, that's what we're learning to use is those pelvic floor muscles. So they're muscles like anywhere else in our body, but we really don't think about them a lot. And unfortunately, they can have some problems where they can be too weak or too tight or not contracting and relaxing the way that they should be. And because of that, people can end up with issues like bladder leakage or pelvic pain or pain with intercourse or pelvic organ prolapse, which is where one of those organs starts to fall down. So my job as a physical therapist is to know about these muscles, to know about muscles in general, the whole body, but I have particular training as a pelvic physical therapist in the muscles in and around the pelvic area and how they relate to this normal bowel, bladder, and sexual function. And our job as pelvic physical therapists is to help people to reconnect to these muscles and figure out how to get them working the way that they should be so that they're not dealing with these symptoms that I was just talking about.
Okay, thanks. And you talked a little bit about some of the problems that you treat. How would somebody know that they may need pelvic physical therapy? What were some things that they might be noticing that makes them say, hey, this might be right for me?
So the most common thing that we probably see people for here are bladder issues. So that can come in the form of bladder leakage. So bladder leakage is any type of leakage out from the bladder that happens when you don't want it to be. So it can be whether you're running, jumping, laughing, coughing, sneezing, lifting. If any leakage comes out, then that would be a situation where pelvic physical therapy may be really helpful. It could also be helpful in situations where maybe you get the urge to go to the bathroom and you can't get to the bathroom in time and you're leaking on the way there. Or some people aren't leaking, but they feel like they know where every single bathroom is and they're going to the bathroom all the time. And so their bladder is basically ruling their life. And so physical therapy can help to kind of help retrain the bladder and make sure that you're going in more normal frequency. Because ideally, when our bladder is working well during the daytime, we should be going to the bathroom maybe 5 to 7 times in a day or every 2 to 4 hours. And we've had patients who are going to the bathroom every 30 minutes or, they can't get through a dinner with the family because they have to get up and go to the bathroom. So, working on the terms of urgency or frequency issues. Pelvic physical therapy also helps with bowel issues. So if you're dealing with constipation and having trouble having bowel movements, it may be a sign that your pelvic floor muscles aren't working the way that they should be. And we can help kind of literally get things going a little bit more and help figure out better strategies so that you're having good bowel movements. The other most common diagnoses that we see people for are some type of pelvic pain. So that can be pain specifically with intercourse itself, or just pain in the pelvic area. So many people, the area around the urethra, the vagina, and or the rectum area can be very sore, tender to the touch. They can feel that pain kind of deeper inside. It can be pain with sitting or with activity. And so that's often a sign that the muscles in the area may not be working the way that they should be. And so that would be, again, another situation where physical therapy could be helpful. And then the last diagnosis that we commonly see people for is what's considered a pelvic organ prolapse. And that's where one of the organs, like the bladder or the rectum or even the uterus itself, start to tip down into the vaginal canal. And it's because they've lost some of that support. And so we work with the people to help kind of get that support back. So those are the most common diagnoses that we see people for.
That's a great overview. Thank you so much. And what would you say to people who say, oh, I thought it was just normal to have urinary leakage because I've had a few babies? Because I hear that a lot, and I would love to hear your response.
And my simple response to that is it is common, but it is not normal. And I wish I could turn around right now and put our clinic shirts here. I have hashtag common, not normal, because that is what I say all the time to people. So yes, it's commonplace that you can end up with some bladder leakage or pelvic problems, especially if you have children, but that's not the norm. We are not all marching back down the path to diapers. And there are things you can do about it. And there are things that you can do that don't necessarily involve you having to do like a risky surgery or trying medications. And that's where pelvic physical therapy can come in. So a lot of people think the only thing that they can do about it is potentially have surgery or take meds. And they don't necessarily want to go down that route. And that's where pelvic physical therapy can offer a very conservative treatment option to people who would rather kind of explore that road with it. And
yeah, that's always the best way to start, is least intervention. And then if you need it, keep going up that chain.
Amen. So yes, because unfortunately I've had patients be told by their healthcare providers, oh, it's not that bad yet. Just wait, come back to me when it gets really bad and we'll do surgery. Like that's their medical advice to the person. It's like, wait a minute, they're coming to you saying they want to do something about this issue. And you're telling them to just wait until it gets bad enough to do surgery for it? Like, no, what can we do now to help this person, not have to
correct it to prevent the surgery?
Yeah.
Right.
Amen. Correct it right now. So yeah, that's true.
And then I hear that you also treat diastasis recti. What exactly is that? And what does treatment look like?
Yeah. So diastasis recti is a name for a separation of the abdominal muscles. So it happens to like 99% of women during their pregnancy. And we're not going to talk on this, but it's not specific just to women. Guys and kids can have diastasis too, but the most common population I see it in is in pregnant and postpartum women. And the easiest way I can explain it is if you think of my two hands as the abdominal wall, and we actually have muscle that is connected in the middle by connective tissue. And as the baby grows, we can start to see that connective tissue kind of spread out and the muscles kind of separate a little bit. And some women will even see it kind of like cone or dome out a little bit. They'll say they'll lean forward and they'll be like, it looks like there's a little alien down there, or a little, I call it the little bread box that kind of shows up there. And like I said, for many women during their pregnancy, especially late in the pregnancy, this is normal. This is our body's way of making room for this growing baby. But what happens is sometimes afterwards, women's bodies need a little bit of help to kind of get everything to kind of come back together and work well together. That sometimes the tissue, depending on how much it was stretched or how we lift, how we move, those tissues end up staying spread, and that can feel almost to the woman like they've got like a hole in the middle. It's not a true hole. It's a stretching out of the tissues there. And we can work together to try and get those tissues to come back together more and get those abdominal muscles more functional and kind of working together. How long it takes and what's involved, then that's like the question everyone asks about it.
Right.
Really depends on the patient and that.
To how severe they're starting.
Yeah, how severe it is. There's so many factors that play into it. So this is one of those diagnoses that you cannot compare to your friend. You can't be like, but Sally, she popped that baby out and looks like she never had a kid 1 week afterwards. Why do I look this way? And why aren't my abdominal muscles working? And I'm, 3 months postpartum, or I'm 9 months postpartum. Every woman is so individual with how her body responds to pregnancy and how we heal afterwards, that the path to recovery is very individual. So we've had patients here that we work with for a couple visits because they just need to be shown some exercises and how to move and work well together. And we have other patients that we've worked with for a long time because their separation is very severe, or they have some really faulty movement patterns and their muscles are really weak, and we've got to work with them to get it strengthened. So anyone who tells you there's a one size fits all fix for a diastasis recti is, I hate to say it, kind of blowing smoke at you. That doesn't happen.
Absolutely. So if you have one piece of advice for expectant families, what would it be?
Ooh, that's such a tough one.
It's hard.
It is a hard one of that. So, when it comes to what the woman is feeling is, your body best, and you may have to advocate for what you feel and what you need. I can't tell you the number of patients that we've had here who have said, I talked to my healthcare provider about XYZ symptoms that I'm experiencing, and they just wrote it off, Brooke. But I had a friend or a family member or someone else told me, no, that's not normal. There's something you can do about it. And so if you're not getting the answer that, where someone's writing you off, then my advice to you is to keep searching and to keep talking to other providers, and don't take that write off of your symptoms as, okay, it must not be anything. So we all know our own bodies the best. And yes, we need the guidance and health of our healthcare practitioners, but only if they're willing to listen to us. And I think, unfortunately, too often women's symptoms get just written off and kind of pushed to the side. And it's like, no. Like, you got to advocate for yourself. And I hate to say that, at this day and age that's the case, but it really is. You have to be ready to advocate for what you're feeling and what you need.
So that's great advice. Hopefully this talk today that people have heard will let them know that there is an option for pelvic physical therapy they may not have known before, and that will help them to be able to advocate better for themselves if they're not listened to, or if surgery is thrown right at them, or if they're blown off. So thank you so much for all the information that you've shared.
You're welcome.
Is there anything else that you want to share with us about pelvic floor that I maybe didn't ask?
So we know that, many people who might be watching this are like, I have never even heard of this. I didn't even know this was a thing, or what kind of things can this even help with? And because of that, we try to make our website as informative as possible for people, as far as, what is pelvic physical therapy? What are the different conditions we can help with? We have several self-help guides, because even though people might be aware of pelvic physical therapy, they may not feel quite ready to go down that avenue yet. But so we want to put that information out there for them as like, hey, here's some things if you are experiencing bladder leakage that you can be doing, or if you do think you have an abdominal separation, here's some things you can try. So we're all about education for both prevention and early interventions, so that people can kind of help themselves. But we're also here to help them, if and when they feel like they're ready to try pelvic physical therapy.
Awesome. So what is that website, and where can people find more information about your practice?
Yeah. So our website is www.legacytherapystl, like St. Louis.com.
Awesome. And we'll have a link below in the description so people can easily find their way to you.
Cool. And I would have had that as our social media handle, but someone had taken it already. So our social media handle is legacyphysicaltherapystl.com. And that's on all the social media channels. And again, we try to get education out that way on our Facebook page or Instagram page, even on Pinterest and on YouTube. So
awesome. Well, thank you so much for talking with us today. I really appreciate your time.
It was wonderful. Thank you.
Thank you. Today we were able to talk to Brooke, a doctor of physical therapy who specializes in pelvic physical therapy. We heard a lot of different reasons that women may choose to see a pelvic physical therapist. If you have any further questions, you can check the description below, and there's links to her website and social media accounts. Thank you so much for watching. We appreciate your time.